7:37. Let's go into the KUM News Zoom room where I don't think he's running for anything either. Might want to run from this pandemic, but he's here. Chima Mbakwem, the acting Chief Public Health Officer for the Department of Public Health and Social Services. Good morning, Chima. Welcome back.
Good morning.
Good morning.
Morning, Sabrina.
Good morning.
How you doing?
Fine, thank you. How are you?
We're all right. We're all right. We're still here.
Thankfully.
Yep. Are you running for office?
No.
Okay. Wait, you're no more acting. Are you the official now?
Yes.
Okay,
All
so
right.
let's start this.
Congratulations.
Let's start this all over, guys. And congratulations.
Well deserved.
Chima
No,
Mbakwem.
it's been since July. It's been since July. So
Oh,
Oh.
sorry.
Should have corrected us.
Yeah, you should have said something.
No, I just try to stay quiet.
Okay, so let me do this again. The official Chief Public Health Officer. And still! Chima Mbakwem. Good morning, Chima.
Good morning, Chris.
Let's go ahead and get right into it. Where do you want to start? I sent you the list of topics. Did you want to start? Let's go start with FEMA and HHS.
Okay, so good morning, Chris. We've been able to welcome the FEMA team that are on island to support the MAB treatment and vaccination sites. But this was after the visit from the FEMA Region 9 leadership that came to do an on-the-spot assessment of our situation, and then they met with public health leadership, met with the hospitals, visited the test sites and the vaccine sites, and made recommendations before they left. And after that, we actually, a week after that, we received the first set of FEMA team, the FEMA contractors that are on island to do vaccination and MAB treatment. So currently, we have 27 of them to support the MAB treatment and the vaccines. For the MAB sites, we have a physician that has clinical oversight of all the teams, and then 2 NPs. For the MAB site, we have 2 nurse practitioners, 2 RNs, 3 LPNs, and 3 paramedics. And then for vaccination, we have a team at UOG that has 1 RN, 10 EMTs, and 10 LPNs. And then there's also another team that will support the Micronesia Mall. We have 1 NP, 1 RN, and then 3 LPNs. And they will be here till the 19th of October. And also we can extend for another 30 days, if it's still needed, which I think we can ask for. So that is where we are with the HHS and the FEMA team. Yes.
Can we start with HHS? You mentioned they were here, the Region 9 person, and they were doing the assessment and kind of, I guess, shadowing you guys. What were the recommendations they made?
Saying the only difference in our plan and their plan was adding another layer to our plan and suggesting that we can also use the second tent at GMH as a sub-Q site, because already they have the infusion site. They were of the opinion that it will also be good, if we can utilize that if need be. But the general assessment was the plans were in place for them to send their team, and unlike other places they went to, Guam was pretty prepared, for them, because we've had everything set up for them to come in. So they came in, I think on Monday, and they've met with public health leadership, they've met with the incident management team, they've met with our nurses. The nursing command actually the nursing command had a meeting with them. They were also part of our planning session meeting on Tuesday for the week. And then they had their fit testing and orientation on Wednesday. And then I think on Tuesday, Then today they are going to work side by side with the public health team at Micronesia Mall and at UOG. So they are already set on the map site. So we're already set and we've hit the ground running. So by Saturday, they will be completely infused in our system and will be able to go on their own.
I meant we were talking about the FEMA team, right?
Yes.
Yeah, I meant the HHS team. You
The HHS
mentioned
team
that
was just the leadership. You know, they came to discuss with us.
Right. Did they provide any recommendations?
Like I said, they actually acknowledged our plans, right? So the only recommendation was adding another site at the hospital if need be. But already they approved of our plans, yes.
I see. So they were only here to review the plans for the monoclonal antibody treatments?
There was just, like we had a surge and we've been meeting with them, on Zoom, and they just came to see what is going on ground, to speak to different players in the field. So they met with the surgeon cell, they met with the hospitals, they met with public health.
Chima, how's the community response been to the monoclonal antibody treatment? I'm just wondering, because I know this is so crucial, right, to treat these positive cases early so they stay out of the hospital. But I'm just wondering, are you guys reaching the positives? Has it been packed from start to finish every day? Or do we need to do a better job of letting people know that this option exists?
No, I think the information is out there for people to use the treatment, right? And then also we have, people on ground, to give the treatment. We have the medication on ground, for people who want the treatment. So I think it's a choice for the individual. We have all the information out there. We are prepared to give out the treatment. We've been giving out the treatment. And remember, GMH has actually been doing this for a long time. So this is just not brand new. But what has happened is that we've scaled up our ability to give out the treatment to more people. That is what has happened. So we've actually used our local resources, the gong and the public health nurses supporting the clinics, to the point where we have a team from FEMA, HHS on ground, to continue that treatment. And also the fact that we are getting supplies, to continue that treatment. So I think it's now for the individuals who are positive, to avail to this treatment that is available now. The locations are out there in public. Everybody knows where to go if you have COVID, and the clinics are also referring people. So it's a gradual process, and people will catch up. And then, but the good thing is that we have that available on the island now, unlike most places that don't have it.
So right now, the 3 places you can get the RegenCove treatments are at GMH. They set up another Blue Med tent so they can get the subcutaneous shot. GRMC and in Manila.
So GRMC has a tent already, and it was recommended that we can use that. But they already have the infusion center at GRMC. There's an infusion center. So like I said, the reason is looking at how we can scale up if there's a need to scale up. In planning, you always have that opportunity to scale up or scale down. So that was one of the places that we can have additional treatment sites if the need be. Yeah, but right now it's at GRMC, GMH, and the Manila Senior Center.
I know we've talked with Dr. Louis Cruz on the opening day over in Manila, and he mentioned that depending on the demand, there are considerations to possibly open other infusion sites. Currently, is that still the plan, or are we seeing a demand where it would necessitate opening up another site? Because I know that the in Alahan Mayor Tony
Chargaloff.
right, he had mentioned that he's kind of put in a request, like he'd like to have one down south.
Yeah, and like you mentioned, so we just have to watch the demand. I think the demand would provide that opportunity for us to scale up. But the good thing is that we have that capacity to do that now with the FEMA team on ground.
So what is the demand then?
The demand.
You're measuring? I mean, when you look at like how many people are showing up for the treatment, and you kind of look ahead, do you anticipate that the demand will increase and thus necessitate the opening of a new center?
So at this point, I think Dr. Cruz and Dr. Bob will be in the right position to answer the question about that one. Yeah, because they are currently managing the sub-Q sites.
Right on. Okay. Let's get into the numbers then.
So what I think Dr. Ann was supposed to speak about the numbers today.
Yeah.
We're still seeing our numbers hovering around above the hundreds, still every day. And what it still shows is that we're still having infection, new infections within the community. So I think with the increase in vaccination, because we're already at 70% of our total population, which is a good sign, and we're also seeing a decrease in the number of people who are symptomatic coming out to get tested, which shows a lot of people are notwithstanding that they are getting infected, they are not getting sick enough to go to the hospital, and this can be attributed to the vaccines, because while we still have cases in the hospitals, but we would have seen more if we were not vaccinating in high numbers. So I think the testing and the number of positives still shows that we're still having a transmission going on in the community.
Right. Yeah, I saw Dr. Ann's report that she released yesterday, and one of the I think it was the very first graphic was that Guam will continue to remain in the current surge until the average daily cases fall less than 25 per day. It seems like we're kind of far off from 25.
Brilliant observation.
Yeah, so looking at the numbers from that perspective, right, and looking at what is going on everywhere, there's still a pandemic. People are getting sick, but with the vaccines, we're seeing less people getting into the hospital, than would have been getting into the hospital if we didn't have the vaccines. So yes, right now we're still testing, and we're still getting, at least we're testing almost 1% of our community every day, which is almost unprecedented in most places, because we're averaging almost 1,500 tests every day. So we are actually testing enough to know what is going on in the community, and also looking at interventions that will help drive down new transmission. So I think there's a balance, and hopefully, we're going to get there. But it's all work in progress for everyone in the community to, help drive down the infection rate.
What did you say? I thought you said that you were considering interventions to drive down transmissions.
No, I said there are interventions to drive down transmission. Yeah.
What are they?
Washing your hands, wearing a mask, keeping your distance, getting vaccinated. It didn't change, It didn't change. So if we still do those things and get more vaccinations, and then at least reduce hospitalization, let people who have other illnesses, be able to access the hospital for treatment, while the people who are infected will not be very sick, while we still, try to drive down transmission.
Right, and the report again by Dr. Ann, it did note that there has been a slight decrease in hospitalizations, and this is a report that spans from July 8th, from the beginning of the surge through September 26th. And so, again, as I mentioned, there's been a slight decrease in hospitalizations, but there has been an increase in
ICU.
Right. And I guess, Chima, that's where the MAB becomes extremely important.
Yeah.
Yes, and remember, when you don't feel well, the first thing you do is you go to urgent care or you go to the ER, right? So that is the first point of entering into the hospital. But what we're seeing is that people are, still going to the hospital. We're seeing people that are in the ICU, and if you're looking at the vaccination rates, you're seeing that we have an increase in number of ICU for people who are unvaccinated that are getting into the ICU.
Bri's crunching the numbers from Dr. Ampovetsky's latest data drop here. She dropped about 12 pages of data, including with the first page here that says Guam will continue to remain in the current surge until the average daily cases fall to less than 25 per day.
Yeah, 25 cases per day. That's what she's talking about.
And we had 192 last night.
Yes.
So Chima, give me an idea here. To get from 192 to 25, we're going to keep doing the same thing.
So this is us as individuals, making that decision to protect ourselves and the community. So that is the only way we can drive down that number. It's about personal responsibility for someone like me, wearing my mask, making sure that if I'm infected, I don't infect any other person, and or making sure that I wear my mask so that someone who's infected does not infect me. So if that simple practice would actually do a lot for us as a community, even when we are with friends, when we are with family members, that we just need to make sure that we consciously, watch what we're doing until the numbers come down, because these numbers are just reflective of what is going on in the community. It's not like it's a congregate setting where we can say, is in one place and a lot of people are infecting each other because it's a congregate setting. But this is, across the community. So that means, there are individuals who are not doing what they're asked to do, and there are also a lot of individuals doing what they're asked to do. Like I can see both of you are wearing your mask in the same room, but I'm not wearing my mask because I'm the only one here. So that will show, the level of personal responsibility that is involved, in driving down the transmission.
It's sad though, Chima, because people hate on us for wearing our masks.
No, you guys are awesome, because I always take note of the fact that when I see you guys with your mask, I always know that there's someone else in the room. So with me too, anytime I'm wearing a mask in my office, that means there's someone in my office. So basically, you get that little chance to get some breathing space, when you're on your own, but, consistently know that when you're with people, you have to just protect yourself and protect them. Because right now, without a test, we don't know who is infected, So you need to be tested to know you are infected. So people might be healthy carriers and would infect others, because you're not feeling sick.
Yeah.
You decide not to wear your mask, But it's important that we continue to wear a mask.
But you can still gather in groups of 25 outdoors if you're fully vaccinated, 10 indoors if you're fully vaccinated, right? So you don't feel like we need to change any of that to get to 25?
You're still wearing your mask, right? When you're not actively eating. So that is the key. You take it off, you eat, and then you put it back on. Remember, if you have flown within this period of COVID, the air hostesses, they have their eyes on you like a hawk. You put the food in your mouth, you cover your face, because even chewing, because they just don't want anybody to get infected. And I think that is the best way to do it. Limit that transmission, within that enclosed space.
Chima, can you provide clarification on this? Because apparently it's going around that there are 26 clusters of variants in Agat that tested positive. Have you heard about this?
That was I think that was it was an outreach that was conducted by public health and the mayor, because the mayor actually invited public health to come and test some people in the community, and we had I think out of 26 there were 23 of them that were positive.
And that's a cluster. I mean, they all.
Yeah, but I think it's a family, or I can't really say if it's a family or like a group of families that live together. But it was on the invitation of the mayor that we actually reached out to them.
When?
And they didn't have access. They didn't have access to come out to get tested. So public health had to go to them, and that's what we are asking for. If you identify those areas that people don't have access to testing, if public health knows about it, public health will send out nurses to those places to test those people, because we want to make sure that everybody gets tested or immunized. Especially people who don't have access to care.
When was this, Chima?
It was, I think, two Saturdays ago.
Was there any other testing done relative to this cluster?
Testing as in
like
any other identified group of people. I can't give you that information now because I don't think yet. But we've had some testing in congregate settings. We tested, I think, Global Dome, 2 days ago, or I think on Sunday, yes. So we still do testing in congregate settings. We still do all those one-off settings. People that cannot access the testing sites, we go to them.
Right.
But across the island, I think we have almost 28 testing sites, between public health, the private clinics, and offices that can actually test. And also we've trained more people to be able to test. Like DOE has been trained. We're going to train the Catholic schools. The private schools are also asking to be trained. We're trying to increase everybody's capacity to test, because with the over-the-counter test, it's easier for you to make quick diagnostic, with the over-the-counter test, you're able to test individuals, who are symptomatic or who needs to be tested right on time, and that would help, detect cases quicker than, waiting to get sick and go to the hospital.
What were the results from the global dorm testing?
The results. Just give me a second.
Okay. Let me read a couple comments here while you're doing that. Please hire more contact tracers. I know a few people were tested positive and public health hasn't called them at all. Over a week already. And all they said is to quarantine at home and don't go anywhere. Matcha comments in here. I wish we can go back in time on the last week of July or first week of August. If more restrictions were placed for 2 weeks, probably by today, we would be at 25 positive cases, maybe even less. We had another comment here. They tested those people in Agat 2 Saturdays ago, and we only hear about it today. I don't remember reading this anywhere. Neither do we. But hey, miss a link, miss a lot.
Any other clusters?
But did you get the results for the global dorm?
Hold on. Yeah, there were just four people who tested positive.
Okay. Chima, can you hold for just a sec? We're going to go over the top of the hour. I think Bri has just a couple more questions. Okay. So, Breeze, we're at KUAM FM, Agat, Guam. Let's fix ourselves. Joe, fix yourself because we're going to go on TV, boy. Okay. Chima, fix yourself. We're going to go on TV.
Yeah, but I have
And just super
like
quick. It's going to be
5 minutes.
super quick. You got it.
5 minutes, guys.
Okay. Got it. Yep. Good morning, Guam. Welcome to the Link, Pacific Points, Cabo Enterprises, ITD, and Jack in the Box on this Thursday morning, September 30th. We're currently in with the Chief Public Health Officer for DPHSS, Chima Mbakwem. Sabrina Salas-Metanani, good morning.
Good morning. So, Chima, let's just pick it up. You mentioned the four that tested positive at the Global Dorms, that's the homeless shelter. Were they all part of the same family unit in a room, or are we talking about four different families? Your audio.
80 individuals, and only 4 of them were positive. So
I'm sorry,
there's
Chima.
nothing going
Chima,
on.
can you go back? I didn't hear you at the beginning. What did you say?
No, I said I don't have that information about the specifics of the case, but at least 80, I think 80 people were tested in that dorm, and it was only 4. So there's no ongoing transmission in the place.
Any other clusters other than what you just told us about what happened in Agat?
Right now, I don't have a cluster report
Oh.
to present. Yes, but if there's a cluster report, I would give you that information. But right now, I don't have a cluster report.
Is there a cluster report being worked on, or are you just there's no clusters to report?
If there's a cluster report, they would have actually presented it to me. So I don't have anything in front of me.
But we didn't get a cluster report for the Agat thing, though.
You didn't have me on air.
Oh,
You didn't ask.
Real quickly, GDOE, the test, not even GDOE, but all schools, right, have to turn in their testing plans by tomorrow. There was one thing that we spoke with John Fernandez, and he was talking about, or we asked him about consent. What happens if a parent doesn't give consent for random testing when they send their child to school? And he deferred basically that he'd have to get more guidance from public health. So if a parent says, no, you cannot test my child, are they going to be prohibited from attending school?
I don't think public health has that authority to stop people from going to school. Yeah.
Okay.
I don't think we can do that. Yeah.
So
I think the consent issue should be more like a school thing with the parents, to go through. If you don't give consent for your child to be tested, I think that should be between the school and the parent, because you're asking for consent.
Okay, just wanted to make sure that was clear. And just one other question, sorry. Have we gotten any more results regarding variants?
No, I think I remember I mentioned that there's a dry ice shortage in Hawaii, so we can't be sending samples to Hawaii. So that's the hold up.
so how long has it been since we sent off samples?
Since the last time we reported.
So a few months.
Yes.
Okay. Is that in any way hampering our ability to adequately respond to this surge?
No, the genome sequencing result just gives you, a better understanding of what is going on, but just not, right now we have a complete picture of what is going on because we are testing and we're seeing cases.
Right.
So the genome sequencing is actually a part of it, is part of surveillance, to understand further, what happened.
Right.
But it's not like the first thing you do.
Okay, no, I got you. I'm just saying that people talking about that mu variant and how it's so vaccine resistant, and we're seeing, these breakthrough cases. So just wondering, but is there, are you tracking like when they're going to get dry ice in Hawaii so we can send
Yeah,
samples?
definitely we do. Yeah, because we also want to send samples to be tested. Yes.
Okay, last question, Chima. 192 cases. 8 deaths over the weekend, 3 the other day, 1 last night. The fire's raging. What's your message to the people of Guam before we let you go?
I think, like I said, it's personal responsibility this time around, right? So, like I said, you guys are okay. I'm okay because I'm alone in the room. But let us continue to, make sure that we follow the public health recommendations about wearing our mask, keeping our distance, washing our hands, making it a personal responsibility to safeguard the community. Please save yourself and save the community. Wear your mask. That's my message. Thank you.
Thank you, Chima.
Thanks,
Thank you.
Chima.
Have a good day, Chris.
Okay,
Thank you,
we'll
sir.
see you. 806.